Hello, and welcome to Buddha's Zen Wisdom, where we're dedicated to bringing you essential health advice every day. In today's article, we are going to explore a topic that, although simple, is one of the most fundamental aspects of maintaining good health: drinking water. It is something that we all know we need to do, and many of us do it regularly without giving it much thought. However, as we will discuss in the coming sections, drinking water improperly can have serious consequences for our health, especially for older adults. So, join us as we delve deeper into the importance of drinking water properly, and how making a few adjustments to your hydration habits can make a significant difference in your health. Case study: Mr. Jon's health scare. Let's start with a real-life example that illustrates the potential dangers of improper hydration. Meet Mr. Jon, a 70-year-old man from New York. One afternoon, Mr. Jon suddenly found himself struggling to breathe and sweating profusely. His family, alarmed by his condition, rushed him to the hospital. After a thorough examination, doctors diagnosed Mr. Jon with coronary heart disease and acute left heart failure. It was a close call, but thankfully, his family acted quickly, and he avoided what could have been a tragic outcome. This wasn't, however, the first time Mr. Jon had experienced heart problems. Just a couple of weeks prior, he had been hospitalized for similar symptoms, which had been triggered by heart failure. After speaking with his family, the doctors began to piece together a disturbing puzzle. Despite following medical instructions and taking his prescribed medication, Mr. Jon's condition had worsened. So, what had changed? The answer, surprisingly, came from a simple daily habit that Mr. Jon had developed after his previous hospitalization. He had started turning on the heater every night due to his sensitivity to cold. In the mornings, when he woke up feeling dehydrated, he would drink an entire glass of water, thinking he was doing something healthy by rehydrating himself. Unfortunately, this innocent habit of drinking excessive amounts of water without realizing its impact on his body contributed significantly to the recurrence of his heart problems. The dangers of drinking water the wrong way. Mr. Jon's case highlights an important issue that many people, especially older adults, may overlook. While drinking water is undeniably essential for good health, doing so incorrectly can cause more harm than good. In many cultures, there is a widespread belief that drinking a large glass of water first thing in the morning is a healthy habit. It's often thought to help rehydrate the body, promote digestion, and even prevent heart problems by thinning the blood. However, what we are learning now is that drinking water improperly can actually pose significant health risks. Consider another example, this time about Mrs. Sarah, a 65-year-old woman from Chicago. Mrs. Sarah had always been diligent about her hydration and prided herself on drinking 8 glasses of water a day. She had always felt that this habit kept her healthy and energetic. However, recently, she began noticing some troubling symptoms. Her face was often swollen, especially in the mornings, and she had developed oily skin. Concerned that this might be a sign of a health issue, her family took her to see a doctor. After a series of tests, the doctor revealed that Mrs. Sarah's hydration habits were inadvertently stressing her kidneys, leading to fluid retention and swelling. What seemed like a healthy habit, drinking plenty of water, had actually turned into a dangerous one. The excessive amount of water Mrs. Sarah was consuming was overwhelming her kidneys, which struggled to process the fluid, leading to visible swelling in her face and other parts of her body. The importance of drinking water correctly. The cases of Mr. Jon and Mrs. Sarah teach us a valuable lesson. Drinking water is essential for maintaining good health, but it is just as important to drink it correctly. Doctors caution that drinking too much water at once can place significant strain on the kidneys and heart, particularly for individuals with pre-existing health conditions, such as heart failure or kidney disease. It's important to remember that the kidneys can only filter a certain amount of water per hour, typically between 800 and 1,000 milliliters. Drinking large amounts of water all at once can overwhelm the body's filtration system, leading to dangerously low sodium levels in the blood, a condition known as hyponatremia, which can cause serious heart arrhythmias. Key signs that your drinking habits might be putting your health at risk. While staying hydrated is critical, it is just as important to recognize the signs that could indicate your body is struggling with excess water intake. If you experience any of the following symptoms after drinking water, it may be a sign that your kidneys or heart are under stress and may need attention. 1. Increased urination at night. A healthy adult typically urinates 0 to once during the night, and the total volume should be about 1/3 to 1/2 of the daily total. If you find yourself waking up multiple times during the night to urinate or producing more than 500 milliliters of urine, it could indicate kidney problems. 2. High blood pressure. If your kidneys are unable to filter excess water properly, the fluid can accumulate in the bloodstream, raising your blood pressure. Over time, this can worsen heart problems and lead to complications such as stroke or heart failure. 3. Swelling. Edema. The kidneys play a critical role in regulating fluid balance in the body. If their function is compromised, you may experience fluid retention, which leads to swelling, particularly in the legs, ankles, and face. 4. Foamy urine. While it's normal to see a small amount of foam in your urine from time to time, persistent and excessive foaming can be a sign of kidney dysfunction. If the foam does not dissipate within 5 minutes, it's essential to consult a healthcare provider. 5. General malaise. Kidney problems can manifest as headaches, poor sleep, itchy skin, memory loss, poor appetite, or fatigue. If you experience these symptoms along with any of the above, it's time to seek medical advice. How to drink water correctly. Important tips. Now that we understand the risks of drinking water improperly, let's turn our attention to how we can drink it in a way that supports our health. Here are some essential guidelines for proper hydration. 1. Drink water at the right temperature. It's important not to drink water that's either too hot or too cold. Extremely hot water can burn your mouth and throat, while ice-cold water can irritate your stomach lining. The best temperature for drinking water is lukewarm, around 40 degrees Celsius 104 degrees Fahrenheit, which is comfortable for your body and gentle on your digestive system. 2. Moderate your water intake. Avoid drinking large amounts of water all at once. The best practice is to sip small amounts throughout the day. If you feel particularly thirsty in the morning, aim for 200 to 300 milliliters, roughly 1 cup, of water, but avoid consuming a whole glass in one sitting. 3. Avoid drinking water during or immediately after meals. Drinking large amounts of water during meals can dilute digestive juices, slowing down the digestion process. It's best to drink water either 30 minutes before or after eating to avoid interfering with digestion. 4. Special care for specific populations. Certain groups of people, such as those with heart failure, kidney disease, or high blood pressure, should be particularly cautious with their water intake. These individuals should consult their healthcare providers to determine how much water they should be drinking based on their specific health conditions. Best times to drink water. Besides knowing how to drink water, it's important to understand when to drink it. There are several key times throughout the day when it's especially beneficial to hydrate. 1. After waking up, drinking a glass of warm water first thing in the morning helps kickstart your metabolism and rehydrates your body after a night of sleep. However, as mentioned earlier, don't drink too much water at once. 2. After napping, if you take a nap during the day, you may wake up feeling thirsty. It's a good idea to drink about 200 milliliters of water to replenish the fluids lost during sleep. 3. Mid-afternoon, between 3 to 4 p.m., many people experience a dip in energy levels. A glass of water during this time can help you stay energized and support cognitive function. 4. Before bed, it's important to drink a small amount of water about 1 to 2 hours before bed to ensure proper hydration overnight. However, avoid drinking too much to prevent waking up during the night to urinate. The right approach for seniors. As we age, our bodies undergo changes that affect how we handle water and other nutrients. Seniors, in particular, are more vulnerable to dehydration and overhydration due to changes in kidney function and heart health. It's essential for older adults to stay hydrated, but the risks of overhydration are even greater for them. In addition to the guidelines above, seniors should drink water regularly but in smaller amounts throughout the day to avoid overloading the kidneys. Monitor their urination patterns and look out for any signs of swelling or discomfort. Avoid drinking water that's too hot or too cold, as their digestive systems may be more sensitive. Conclusion: how to ensure healthy hydration. To sum up, drinking water is vital to maintaining good health, but how we drink it matters just as much as how much we drink. For seniors and individuals with underlying health conditions, it's essential to follow the guidelines on proper hydration to avoid exacerbating existing health problems. By drinking the right amount of water, at the right times and temperatures, we can support our kidneys, hearts, and overall well-being. Remember, hydration is key, but moderation and timing are just as important. If you have any concerns about your water intake, it's always a good idea to consult with a healthcare provider to ensure your hydration habits are best suited for your health needs. Stay hydrated, stay healthy, and take care of yourself, because every small step you take toward caring for your body contributes to a longer, more vibrant life.